there's no question that some people would tell you that children do not really develop this disease, and that is not true. Children do get COVID. I think in general, children have less severe symptoms. They may be more likely to be asymptomatic with their infections. Again, I mentioned that some kids do develop more complicated complications from COVID, but they are able to transmit this and share it to others. And potentially those children can bring it home to an adult in the household or to potentially somebody who's a grandparent or somebody else who would be at high risk. So we actually know in most diseases that children are, in most respiratory viruses, children are the main pathway for how these infections spread. In influenza, as an example, children are a major focus of how influenza spreads in communities because they have much higher viral loads and they tend to be more cohorted together. So they tend to not wash their hands as well. They sneeze and cough on each other, and so they're more able to transmit. So preschools are a classic location where you see transmission. I think we're beginning to understand that children are going to be more of a vehicle, but the data suggests in Israel, as an example, where once they opened schools again, that they had sort of more transmission in the schools, and then you saw the numbers in Israel just take off again. So opening schools tended to sort of really explode the community outbreaks as well. So I think when we think about kids, it's the same policies and same procedures that we think about in terms of prevention. It's masking, it's washing your hands, social distancing as best as possible.